Good evening. This is All India Radio Kohima. I'm Jonas Yantan with Evening News. The headlines. Government enables on-site registration for 18 to 44 years age group on CoWin. Advisor Mmhonlumo Kikon says PSA oxygen plant in Dimapur District Hospital to become functional from tomorrow. Centre to provide assistance of 1,500 rupees to each transgender person to meet basic requirements in view of COVID pandemic. And RDIF and Panacea Biotec announces launch of production of Sputnik V in India. As the number of COVID cases are on the rise, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 years who have taken the first dose of COVID-19 vaccine to get vaccinated with second dose at a scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. Now the news in detail. The centre has decided to provide a facility of on-site registration and facilitate cohort registration on CoWin digital platform for people in the age group of 18 to 44 years. This facility will only be available at government COVID vaccination centres, CVCs. It will not be available for private CVCs, and they will have to publish their vaccination schedules exclusively with slots for online appointments. However, the on-site registration will be enabled in case of sessions exclusively organized with online slots towards the end of the day, as some doses may still be left unutilized in case the online appointee beneficiaries do not turn up on the day of vaccination due to some reasons. In such cases, on-site registration of a few beneficiaries may be necessary to minimize vaccine wastage. The Union Health Ministry said, even though CoWin provides for features like registration of up to 4 beneficiaries with a mobile number, facilitated registration and appointments through applications, people requiring facilitated cohorts facility, and those without access to internet and mobile phones may still have limited access for vaccination. The ministry said this on-site registration feature will be used only upon the decision of the respective state governments to do so. The state and union territories must decide on the opening of on-site registrations and facilitated cohorts registration and appointments for 18 to 44 years age group. This should be based on the local context as an additional measure to minimize vaccine wastage and for facilitating vaccination of eligible beneficiaries. The ministry has advised the states and union territories to issue clear instructions to all district immunization officers to strictly adhere to the decision regarding the extent and manner of using the on-site registration and appointment feature for people in the 18 to 44 years age group. Fully reserved sessions can also be organized for providing vaccination services to the beneficiaries belonging to facilitated cohorts. The ministry added that wherever such fully reserved sessions are organized, all efforts must also be made to mobilize such beneficiaries in sufficient numbers. It also said abundant caution should be exercised and extreme care should be taken while opening up on-site registration and appointment for people in the age of 18 to 44 years to avoid overcrowding at vaccination centers. Nagaland spokesperson on COVID-19 advisor Mmhonlumo Kikon has announced that the PSA oxygen plant in Dimapur District Hospital will become functional from tomorrow evening. He said Chief Minister Nipirio, along with members of high-powered committee, will also inaugurate the 30-bedded police referral hospital, Kohima, tomorrow, and thereafter visit the 176-bedded hospital at CIHSR. Addressing media persons in Kohima today, Kikon said this dedicated COVID hospital will offer essential medical services without disrupting the people and also ensure that a holistic approach is taken in treating COVID-19 patients. The advisor also informed that the state has so far not reported any cases of mucormycosis or plaque fungus. On the issue of availability of oxygen in the state, Kikon said people need not worry about it as the state has sufficient oxygen to deal with. He said the state has a total of 1,558 oxygen beds and concentrators till date. There are 980 cylinders available in the depot in Kohima, and by tomorrow 800 more cylinders will be arriving from Ahmedabad, he added. The state spokesperson also said 1,400 vials of remdesivir have been received from the Health Ministry, while a total of 118,050 doses of vaccine are presently available in the state, which has been distributed to the districts. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. The government has decided to provide assistance of 1,500 rupees to each transgender person as immediate support to meet their basic requirements in view of COVID pandemic. Social Justice and Empowerment Ministry said that this financial assistance will help the transgender community to meet their day-to-day needs. It has asked NGOs and community-based organizations working for transgender persons to spread awareness about this step. Any transgender person or community-based organizations on behalf of the transgender person can apply for financial assistance after providing basic details like Aadhaar and bank account number. They have to fill a form which is available on the website of the National Institute of Social Defense, an autonomous body under the Ministry of Social Justice and Empowerment. The ministry said a helpline number 8882 133897 has been launched for mental health care of transgender persons. This helpline will be functional from Monday to Saturday between 11 a.m. to 1 p.m. and 3 p.m. to 5 p.m. The Russian Direct Investment Fund, RDIF, and the Indian biotechnology company, Panacea Biotec, have announced the launch of production of the Russian COVID vaccine Sputnik V in India. This move will boost the production of vaccines and help in facilitating the supply of Sputnik V. In collaboration with the RDIF, Panacea Biotec will produce 100 million doses of Sputnik V per year. In a statement issued by Russia's Sovereign Wealth Fund, RDIF, the first produced batch of vaccine by the Panacea Biotec's facilities at Badri will be shipped to Gamalaya Center for Quality Control. As per the SOP issued by the Ministry of Health and Family Welfare and Home Department of Nagaland State Disaster Management Authority, Dimapur District Administration has issued guidelines for management and disposal of COVID-19 bodies. Deputy Commissioner Dimapur Rajesh Sundararajan informed that the identified dead bodies will be handed over to the relatives for proper burial after taking all infection control measures by the concerned hospital. It stated that the unclaimed dead bodies will be taken over by the State Disaster Response Force (SDRF) for proper disposal. However, in circumstances where the relatives are not in a position to take a COVID-19 positive dead body due to various constraints, the SDRF will assist in disposing of the dead body. In the case of needy or poor families who are not in a position to pay any incidental cost of disposing the dead bodies, the district task force shall bear the expense for the same, it added. The cyclonic storm Yas is very likely to move slowly north-northwestwards, intensify further into a severe cyclonic storm during the next 12 hours, and into a very severe cyclonic storm during the subsequent 24 hours. It would continue to intensify further and reach northwest Bay of Bengal near North Odisha and West Bengal coast by early morning on Wednesday. It is very likely to cross North Odisha, West Bengal coast between Paradip and Sakar Islands around Wednesday noon as a very severe cyclonic storm. And now 20 News, here are the main points again. Government enables on-site registration for 18 to 44 years age group on CoWin. Advisor Mmhonlumo Kikon says PSA oxygen plant in Dimapur District Hospital to become functional from tomorrow. Centre to provide assistance of 1,500 rupees to each transgender person to meet basic requirements in view of COVID pandemic. An RDIF and Panacea Biotec announces launch of production of Sputnik V in India. That is all we have in this evening news bulletin. Good night.